Hello friends, this is Dr. Nikita here, your educator, mentor and friend. And here we are to discuss the part 2 of the new drugs. The part 1 we have already discussed in another video. If you have not watched that, please watch it. It's very important for your upcoming exams. So we had already discussed the oncology related drugs. Just a quick correction here. Please make it in your notes as well that dostarlimab is against PD-1, not PD-L1. Right, so that's a correction that I wanted to mention. So we have seen oncology drugs and multiple myeloma, leukemia, neurology wale drugs is what we had already seen in part 1. So what we would be learning now is about infectious diseases, cardiovascular drugs, endocrine wale drugs. So in infectious diseases, in antibacterials, the newer drugs, gipotidacin, remember like levofloxacin, ciprofloxacin, it is sounding like that acin, but it is not a fluoroquinolone. It inhibits DNA gyrase and topoisomerase 4, like fluoroquinolones also do that, but this causes single stranded break in the DNA, not double stranded, and it is not a fluoroquinolone. So remember, the mechanism of action is different, and that is why it is active even against bacteria which are resistant to other fluoroquinolones, and this is used in uncomplicated UTIs. So gipotidacin, similar to fluoroquinolone, like levofloxacin, gipotidacin, but different from that. Remember, it is both T and D inhibiting, that is your topoisomerase and DNA gyrase inhibitor. Plasmomycin is a next generation, like you have streptomycin. So mycin, it is a next generation aminoglycoside, again used in complicated UTIs. Floxacin, like ciprofloxacin, levofloxacin. So FL, it is a fluoroquinolone, which is active, which has consistent activity against MRSA, and it is used for skin infections. Remember, dilafloxacin delays MRSA infection, so it is active against MRSA. Ceftaroline, which cephalosporins are active against MRSA? Remember the 5th generation cephalosporins, ceftaroline, and you have ceftobiprole. So it is ro wale drugs which is active against MRSA. Remember, with these drugs, MRSA हो जाता है, रो करने लगता है, the MRSA cries कि now I have drugs which will kill me. So ceftaroline and ceftobiprole, these are MRSA active. Then you have newer tetracyclines, omadacycline, iravacycline, and sarecycline. So cycline, these are tetracycline drugs. OMA, remember it like mast cells, respiratory system. Then you have iravacycline is for intra-abdominal, and sarecycline, skin wala, that is for acne. S for sare, S for skin, acne. Tuberculosis, pritomanid, delamanid, what is the mechanism of action? Remember, MAMA. This is mycolic acid synthesis inhibiting drugs which are used, and they generate free radicals is what they generate. Right, even isoniazid, INH, also inhibits mycolic acid synthesis, but by a different mechanism. And in INH, it inhibits INHA, which is important, an enzyme which is enoyl reductase, important for mycolic acid synthesis. Pritomanid, delamanid, they generate free radicals. Pritomanid, delamanid, mycolic acid, MA. Right, NID tells you that it is nitroimidazole drug. Bedaquiline is ATP synthase inhibitor, very, very important. Remember A and B. ATP wala is bedaquiline. Coming to anti-malarials, very important, tafenoquine, like primaquine. Remember, anti-malarial. So tafenoquine is a single dose radical cure. When I say radical, it kills the hypnozoites. So used for Vivax and Oval. Tafenoquine, like primaquine. You need to test the G6PD status for this drug. Tafenoquine, important, single dose radical care. Lenacapavir, vir matlab again some virus. Which virus? HIV-1. Cap matlab it is acting as a capsid inhibitor, and L for long acting. It is capsid inhibitor. Glorifimab is a respiratory one. RSV in infant is what it is acting as. For RSV, you have glorifimab. Okay, for that you have glorifimab. Now coming to cardiovascular system and metabolic. So in cardiovascular, we have this very important drugs, nicorandil. So nicorandil is used for angina, Remember it as nicorandil, write it as Nico, KO is a potassium channel opener. Remember, it's not a potassium channel blocker, but opener. So it leads to vasodilation and decreases the preload and afterload. Ranolazine, NOLA, write it as Na sodium late, NALA. Okay, so ranolazine is the late sodium influx inhibitor. By doing that, it is decreasing the calcium and decreasing the cardiac work. Trimetazidine, metaz, remember it as metabolism, making it 0. So the basic fatty acid oxidation, the P-FOX fatty acid oxidation is what it inhibits. Metabolism 0, fatty acid oxidation 0. It is shifting the metabolism to glycolysis, which requires less oxygen, so decreasing the oxygen demand. Then we have omecaptiv, a new drug. It is myosin activator. So read it as CAM is MAC, which is myosin activator. M for myosin, AC for activator. So it is activating myosin. So it increases the cardiac contractility in patients of heart failure with reduced ejection fraction, but without acting on calcium. Right? Drugs like dobutamine, vagera, they'll increase the calcium, but this is going to be without acting on calcium, directly myosin activator. Then we have sacubitril valsartan. Valsartan is ARBs, angiotensin receptor blocker, and sacubitril, it is your neprilysin inhibitor. So ARNI combination, valsartan, sacubitril, in heart failure patients, it decreases mortality because neprilysin, it increases the natriuretic peptides level and decreases the fluid overload, causes vasodilation. So sacubitril plus valsartan, ARNI combination. Coming to endocrine and GI, tirzepatide, like semaglutide, that is your GLP-1 drug. Tirzepatide, TIR, it is two mechanisms by which it is increasing in insulin raising. Okay, it is insulin raising. So GLP and also GIP. So it helps in increasing the insulin. It is incretin drug, right? Dual incretin by acting on both GLP and GIP. So it decreases the blood glucose, decreases the weight as well. And recently it has been approved for OSA as well, obstructive sleep apnea. Lorcaserin is serotonin, so 5-HT2, that is serotonin agonist, 5-HT2C, which suppresses the appetite. Set melanotide, melano is your melanocortin 4 agonist, and by doing that, it treats obesity in Bardet-Biedl syndrome. Then you have saroglitazar. Remember, like glitazone, pioglitazone, rosiglitazone, but this is glitazar. So similar to that drugs, it is acting on PPAR gamma, but also PPAR alpha. So remember, saro acts on SARA PPAR, that is alpha and gamma both. So it is alpha and gamma both. So basically, it will act in diabetes also, and alpha is for fats. Remember, PPAR alpha is for fat. So it acts in diabetes also. So diabetic dyslipidemia is what it is acting upon, and treats the NAFLD, non-alcohol fatty liver disease, NASH, and also hypertriglyceridemia. Tegoprazan, like your pantoprazole, so prazans, which are used for prazoles, which are used for acidity, GERD, the reflux disease. The difference here is tegoprazan is a PCAB, that is potassium competitive acid blocker, and this operates independent of meal timing. It surpasses even your PPIs, proton pump inhibitors. This is PCAB, tegoprazan. Prucalopride, like you have AIIMS, which we have discussed in SureShot course on MedSynapse App, the electron transport chain inhibitors. AIIMS drugs like cyanide, carbon monoxide, they are ETC chain में complex 4 inhibitor. Similarly, this AID is your 5-HT4 agonist, which is used for constipation. Okay. Tenapanor, NAP, Na and P, it is sodium and potassium exchanger inhibitor. Okay, this is also used for constipation, tenapanor. Immunology, dupilumab, du is di-interleukins, IL, remember interleukins, which interleukin 4, and 1 plus 3 is also 4. So 4 and 13, both of these are important. Like interleukin 4 is very important for IgE switching, right? And 13 also has a role in it. Both of these cause Th2 cell activation, allergic diseases mein role hai. So these are used in urticaria, atopic dermatitis, where there is role of IgE, dupilumab. Secukinumab, remember SESE 17 wala, it is interleukin 17 inhibitor used in psoriasis. Mirikizumab, interleukin 23. Remember, Miri is like by re. By matlab 2, re is 3, that is 23 inhibitor used in IBD, inflammatory bowel disease. Fitusiran, Siran is siRNA wala drug. It is acting on antithrombin, decreasing antithrombin, so increasing the thrombin level, promoting the clot formation in hemophilia A and B. So bleeding में clot formation help करेगा. Fitusiran. Then you have nipocalimab. Nipocalimab is FC receptor wala blocker, the IgG ka FC receptor blocker, so preventing the Ig, the antibodies generation in myasthenia gravis. You have nipocalimab, right? So that was about the part 2 of the new drugs. We have many more such tricks and all subjects preparation for NEET PG, FMGE, INI-CET on MedSynapse App by Dr. Nikita. We do have a lot of free mnemonics videos also there, a lot of free test of the day also going on. So please make sure you make the best of those resources available on MedSynapse App. And you have a dedicated SureShot course. Like in the last NEET PG, we had around 155 from 200 questions. From those, just 80 hours of content, the SureShot and Extra Edge on MedSynapse App. The PDF of this you can download again from MedSynapse App. I'll be putting the link in the comment section as well and in the description. So you can download the PDF for this, and do not forget to revise this before your exam. Thank you so much. That was for today.